Cardiopulmonary Rehab is a supervised exercise program that combines exercise, education, nutritional counseling, stress management, and smoking cessation to help individuals with heart and lung disease. The goal of rehab is to help patients understand their diagnoses, learn how to prevent disease progression, and return to daily work and leisure activities.
Hello, I'm Jim Shillinger, and I've been a patient at Pinckneyville Rehab for about 3 years on and off. What brought me here, I guess, is being an ex-teacher. I still have people that think I'm a current teacher and toilet paper my house. And I was out picking up toilet paper and developed chest pain. I came out here and the ER people said I wasn't having a heart attack, and I got referred to a pulmonologist, and he ended up diagnosing me with pulmonary fibrosis. I then was referred to Indianapolis Methodist Hospital to get evaluated for lung transplant. The people at Indianapolis said that I need to get in a little better shape to get the transplant, and they referred me to Pulmonary Rehab. Ended up at Pinckneyville. Eric Campbell and his whole staff were very, very professional. They treated me like an individual, and they gave me a lot of motivation and guidance. They also kept me from overdoing myself. I was here off and on for probably 3 or 4 months before I got in good enough shape to have the surgery done. During that whole time, I was monitored constantly. I was on machines, and if I had a little chest discomfort, breathing issues, they were right on it and told me to relax, everything's fine. And another thing I appreciated, pulmonary rehab is a little different from cardiac rehab in the fact that if you have breathing problems, you only get so many visits. I think it's around 70, I'm not sure. And with cardiac rehab, you're unlimited. So as I was reaching my maximum number, Eric and his staff, along with Indianapolis, I assume, said that I could get by working on my own, and they referred me over to the wellness center to work on my own. And during that time, they still kind of babysat me a little bit and make sure I was handling things in a professional manner. But the important thing is that left me time to come back to pulmonary rehab if I needed it. And for a person that had some issues, I was in pretty good shape when I went in for the lung plant surgery. After my surgery, I was in ICU for a day and a half. Then I was in the regular hospital for what would be 9.5 days. And while I was in the hospital, they told me that I was setting records for discharging from different places. And they stated that it was a result of my pre-surgery work that was done at Pinckneyville. So I was very pleased. I know the hospital in Indianapolis was pleased. And we're going from there. I still come out and work when I can.
If you're interested in our program, please have your provider or specialist reach out to us at 618-357-5907, and we can discuss your care and possible entry into our program.